doorway isometrics. I'm obviously not in a doorway, but at home, it's easiest to set up in a doorway. So if the door jamb comes up and over, usually you'll have an ability to hold on both sides. Or if you're at a gym, you can use a squat rack. You just need something immovable that allows you to easily move around it so we can hit your shoulder in a bunch of different ranges. It's important to talk about positioning. You want to have an upright torso. We want to do a really good job of keeping our shoulders centered in that joint. And you're doing your best to not cram your elbow into your side. So just arm hanging, shoulder centered. And then we want to do our best to take our wrists out of the motion. Most people really want to pull in. So if I'm pulling into internal rotation, they'll pull with their wrists and not their shoulder. So we want to get you with your wrists past your point of contact so we can isolate the shoulder joint. So if we're going to do external rotation, we get the back of our arm and we're just pushing out as able. This is going to depend, how hard you push is going to depend on where you are in your stage of rehab, whether you're post-surgical or you're coming off of a conservative approach. Let your body tell you what's too much. You need to give yourself at least 24 hours to 48 hours before you push harder. The goal isn't in every session that you push as hard as you can until pain comes on. We're just going to try to build over time. So internal rotation would be my wrist, and then I'm pulling in or pulling my arm across my body. External rotation, again, just a reminder, is bringing my arm out in this direction. And then flexion, do your best not to lean. A lot of people will really try to lean into the wall here. Make sure we're doing a pressing motion, nice and gentle. And then the last one is our abduction moment. So I'm going to get my elbow and I'm just going to gently push. Make sure you pay attention to your handout or your home exercise program, because some of you that are in rotator cuff repair protocols are not going to be able to do every single one of these motions. It'll make sure to say internal rotation, external rotation, abduction, or flexion. And I just went over those, so rewind if you need to. Just quick internal rotation, external rotation, flexion, abduction. Again, the goal is not to push as hard as you can. Let your body guide you.